All right, there's some really common questions that occur in this space. So let me go through a few of the answers to those questions. All right. So first of all, you've got a little card here, which is a preparation list for your first HOPE procedure. And it says list several supplements that you may want to take. Now, there's a reason for each of these, and we're very much doing everything possible to optimize your outcome, to optimize your procedure. One is called IgEs, and IgEs has a components in there that decrease the reactivity of a molecule called histamine that is in the body. One of the mild side effects that can happen in plasma exchange is with a histamine response, kind of an allergic response. And this is something that we've found to be very helpful in decreasing how much histamine has an effect during the procedure. But you have to do it ahead of time. VascuSave is a combination of flavonoids that decrease the amount of injury to the blood vessels and cause a increased blood vessel health while we're waiting for this procedure to occur. C complex is a vitamin C plus bioflavonoids. It's a very potent antioxidant that helps decrease the amount of blood vessel irritation. Vein Sustain is a remarkable compound that is helpful for helping the veins to be strong, and it helps oxygen delivery from the veins. It's actually been shown to be very helpful in the treatment of things like hemorrhoids and varicose veins and anything to do with vein health. And since we're going to be using your veins a lot during this procedure, we want to make sure they're in tip-top condition. And the daily NRG with iron is a very high potency, broad spectrum multivitamin that's going to give the nutrients at levels that are important for you to have long term and prepare your body best for this procedure. It's going to be important for you to continue on something like this as a regular supplementation for yourself long after your HOPE procedures are completed. We also state here to make certain that you arrive well hydrated, right, and eat a meal beforehand because we're removing blood sugar as we go, and your body can make that extra blood sugar very easily if you have a little bit of fuel available. So those are basically the most important parts, 2.5 hours. And it depends on how big a person you are, how fast the blood flow can come out of your veins, and exactly what type of procedure and modifications we're making for your particular needs. There are many components that we will use to help improve your signaling, and one of those are a component called an exosome. An exosome is a small packet of information that has been harvested from a stem cell that came from a placenta. The placenta, is right where all of us came from, is a remarkable organ that is uniquely capable of creating health. And so women who are very healthy, who have been screened carefully for infectious diseases, will donate their placenta for this purpose. And those cells are extracted, and the components of the stem cells come off, and we call these exosomes. And when those are given as part of the HOPE procedure, we get to take advantage of the quiet room phenomena, right? I probably said this before, but plasma exchange is an amazing opportunity to clean the bloodstream so that the signals that may be perpetuating inflammation or accelerated aging or tissue injury, those signals are removed. And now we have this very quiet molecular signaling arena to enter in these wholesome compounds that will send a message of healing and growth and repair to the body. We find we have several different components that we utilize. This is customized according to each individual patient and with regard to the dose and the type. And that is part of our unique process in understanding what you may need. Now, exosomes help to induce a healing response. So some individuals may feel kind of tired and a little bit washed out for a few days while that healing is taking extra energy. And then there's quite a remarkable improvement in the body's ability to function. We see a lot of additional healing happen when we get to use these habitat uplifting growth signals, or as I like to call them, hugs. So one of the replacement fluids that you're going to be getting is albumin. And the question is often present, well, where does this albumin come from? And it comes from people who are generously donated plasma. What happens is many plasma donations are combined together, and like about 8,000 different donations go into one vat. And then they are separated out into two major components. One is albumin, which is the major protein that floats around your bloodstream. And the other are your immunoglobulins, your antibodies, and all the other molecules that control your coagulation and control lots of other aspects of function in the body. And so if we think about it, so you get all of this albumin. Now think of albumin like a big sponge, and it holds on to many other molecules, calcium being one of them, but it also holds on to hormones. It holds on to other cellular messages. It's also a sponge that holds on to amyloid beta, one of the molecules that's associated with Alzheimer's disease. It holds on to toxins. It holds on to components that are not good for us. So as we remove your plasma, removing your albumin that is polluted is one of the most important aspects of the entire procedure. So the albumin that gets put back in, however, has been separated from this large number of donors, and then it is cleaned. It is heated up to 160 degrees, and they keep it at 160 degrees for over a day. And then it is washed, so fluids are brought in, fluids are brought out, and it is clean. And so and in that process of raising the temperature of the albumin, it stretches out a little bit, and the things that are attached on the outside fall away. And then as the albumin, that gets washed, and as the albumin comes back to its normal shape again, it is a cleaner albumin. And so that is then what is put in bottles and is then used in our process as a replacement fluid. Now, it's very clean. We know that there are no antibodies in there. There's no infectious molecules in there. And there's no other proteins that would be concerning. It's just albumin. And that is this replacement fluid. Now, if we didn't put in albumin, what would happen is the fluid that would go in your bloodstream wouldn't be held onto, and it would escape out in the tissues, and you would get very puffy and have a lot of edema. So the albumin is a very necessary part of this procedure. There's no other way to do it without it. But it's a very safe. We get it from several different pharmaceutical companies. It is FDA regulated, approved substance for this purpose. The question is, what happens to my plasma after it's been taken out? Well, it's thrown away because that is a polluted plasma. And FDA regulations do not allow us to utilize that plasma as a raw material for making albumin or other therapeutics down the road. The question is often asked, if this is working on a cellular level, am I going to notice anything? Is my family going to notice anything? And that really depends upon you. That very much depends upon what effect is your challenge having on you. Is it aging? Is it hypercoagulability? Is it too many antibodies that are causing autoimmune disease? Is it the burden of an infectious disease process that's going on? Is it the molecules that perpetuate Alzheimer's disease and Parkinson's disease? What is being removed makes a big difference with regard to how you're going to feel. I will say that most people feel good after a plasma exchange. Some individuals feel a little tired because there is a healing response that goes on when your progenitor cells that live in all of your tissues become activated and start doing the job of repairing their local environment, because that takes energy. But most of the time, this is about improving the health of your system, not suppressing your symptoms. And so when you do feel better, it's something that comes from very deep. It comes from the ability of the body to heal. And really remarkable things have happened. People have had incredible increases in their athletic performance. They see better, they can hear more sharply, their memory has improved, their pain goes away, their autoimmune processes calm down. So lots of wonderful things can happen, but the responses are as individual as you are. We're constantly adapting your plasma exchange for your best benefit. And many of those labs are helping us to better target your individual needs and how your body responds to a plasma exchange. It also is always a double check on how much plasma was removed, and it gives us very important information for your care. Let's really think about this, that your cellular health is what we are working with. And because each plasma exchange, while we remove the equivalent of the entire amount of the plasma that's living in your body at the time during a plasma exchange, that clean blood now has to seep its way in to the fluid around your cells. Remember the extracellular fluid. And it cleans that extracellular fluid, and that dirty extracellular fluid now comes back into the bloodstream. So with the first plasma exchange, we clean the blood, and then the body gets a little cleaner. With the second one, we clean the blood again, and now we have a cleaner body to work with, and the body gets even cleaner. With the third, same thing, the body gets even cleaner. So repeated plasma exchanges are very important for us to really get the cellular healing that this procedure is designed for. In individuals that have severe autoimmune disease, this procedure is almost always done twice or 3 times a week for months. It takes a lot to clean the body. We believe that and we're always trying to find the right dosage for people. And that's why your evaluation and recommendations were unique, and I'd strongly recommend you follow the recommendations that were given. That is going to be as unique of an answer as your problem is. You know, some individuals come to us recognizing that the science is so strong that they've crossed over their 50th birthday and they want their cells to behave more like a young person, and they want to get ahead of the degeneration that is aging. And those individuals who are already quite healthy are probably not going to feel different from it, but they are going to function different on a cellular level. Other individuals that have a progressive autoimmune disease will have noticed probably some of the most acute changes that happen, because plasma exchange very quickly changes the behavior of the immune system. It doesn't just remove autoantibodies, it actually changes how immune cells work themselves. And that can be quite remarkable. Individuals that are suffering from cognitive decline, and remember what I just said there, cognitive decline. if you don't do anything about your situation, you're going to be worse off next month and the month after and the month after. And neurodegeneration is a terrible thing for a person or a family to experience. So an incredible win is just even the slowing of the process of degeneration. If we, but tracking, we really hope to stop the progression, which we have good data to support. Approximately 70% of individuals with Alzheimer's disease, we can halt their progression. We have good data going out 18 months. And then the individuals who come to us early with cognitive decline actually have improvement. Their brain starts to sharpen, their memory can improve, and their cognitive capacity can improve. And these can be subtle findings, but wow, are they important findings. So, and it's so difficult to, when you're inside your own brain, to know how your own brain is functioning. And that's why we encourage you to talk to people around you to see how they think you're doing. But at the end of the day, you really have to focus on improving the health of your system, not banking your idea on your symptom. Because being healthy is a really profound state that we know our process of plasma exchange enables. But if you have any other questions, we are here to serve. And ask the nurse, ask our team, and we'll do our very best to get you the information you desire. We know that you are the most important part of your health creation journey, and we want to empower you in being able to be the most effective self-healer that you can be.